Hello viewers, welcome to our channel. My name is Shrujna and today we are with Dr. Rani, BHMS and MD, homeopathy expert and professor in one of the renowned educational institution who works for 17 plus years clinical experience. Let's quickly welcome her. Hello ma'am, and firstly thank you so much for scheduling our interview with us.
Welcome.
Okay. Nowadays, many women in our society are facing the absence of their menstrual periods. They are not getting their periods on time. Due to many reasons, it could be because of stress and anxiety, because of the quality of food and many other reasons. What could be the cause of this problem, and does homeopathy has any treatment for the continuation of menstrual cycle?
Yes, very good question. Usually from 13 years of age girl to 45 years of woman. So many people came with complaints of the absence of menses to my clinic.
Okay.
So I have treated number of this absence of menses. So few girls make complaining of the 3 months of absence, 6 months of maybe absence, maybe 1 year. Like the different presentation will be there. So what exactly this absence of menses means? We call it is amenorrhea. Amenorrhea is defined as that absence of menses of a reproductive age group. Usually after menopause there will be no menses, but a woman of reproductive age group, if absence of menses, we call it is amenorrhea.
Yes.
So this amenorrhea is considered as the two types, like primary amenorrhea and secondary amenorrhea. So as we earlier said, after the 16 years of age also few girls, they are not menstruate. So that we call it is primary amenorrhea. So then secondary amenorrhea, coming to secondary amenorrhea. So this is that very important symptoms nowadays. We can see that from school going children to that college students, working women, so everyone facing this secondary amenorrhea. So causes are different, but so the main cause I have seen in my practice, it is that PCOS, that is the polycystic ovarian syndrome. So I have treated many cases of this, the cause because the PCOS, that woman having that absence of menses.
Okay.
So apart from that, number of causes are there. As we earlier said, there is an axis should maintain in a woman. That is the hypothalamo pituitary ovarian uterine axis. So that abnormal functioning of this axis may leads to this amenorrhea. That is the main thing. So why it is that abnormal functioning of this axis is important.
Okay.
The cause may be, you can see in hypothyroid cases, then we'll have that some women, they will use that history of the antipsychotic drugs, antidepressant drugs. So these may suppress the menses.
Okay.
And apart from that, poor nutrition and overweight, excessive gain of that weight, or otherwise excessive loss of weight also.
Okay.
And if a woman is having that severe illness followed by that absence of menses, suppose she may suffered with the typhoid for months together, then followed by there is absence of menses. There's a after severe illness that girls may having that absence of menses, the suppression of menses.
Okay.
Apart from that, there is that fear, and that girls who are nowadays they are preparing for the competitive exams.
So emotional conditions are also affecting.
Yes, emotional stress. That is that main factor which giving the dysfunction of this axis. So that's why that school going children and even that college students who are for that exam, especially exams, before exams. So this is a common complaint. So this during that exam, there's no menses. Like that, the stress factor plays very important role. So here homeopathy plays very, very important. So homeopathy considered everything. So homeopathy, case taking, having that stress level at emotionally we will take, and stress at environmental, that is workplace, even in the families.
Okay.
So our case taking is depending on like that. So a thorough case taking, which in that it includes that girls stress or women stress. So these are all includes in the thorough case taking. And after that, a proper investigations. So that is necessary for diagnosing of this amenorrhea. So to diagnose secondary amenorrhea, that woman should have regular cycle and followed by 3 months absence of menses. We consider that is a secondary amenorrhea. Okay. So otherwise, if woman is having the irregular period since puberty, she may complain that I'm having irregular periods since puberty.
Okay.
And followed by 6 months of amenorrhea. So that also we considered as a secondary amenorrhea. So in these cases, we have to go for thorough case taking and proper investigations. Then we can come for the conclusion of this diagnosis.
So we can understand first what could be the cause of each person's problem, and then we can treat according to it.
Obviously.
Right.
So simple, there may be only functional amenorrhea. I said before, fright, stress, these may be factors. And in some cases, we have some PCOS, hypothyroidism, and we'll have the tumors in that uterus, and tumors in the ovaries, and even tumors in the pituitary gland. So that may having also that cause for this amenorrhea. So first we have to rule out what is the cause. So then we have to give treatment according to the cause.
Okay, ma'am. So some women enjoy their periods, but few other unfortunate women suffer extremely because of the cramps and severe pain. Why is this happening, and what could be the cause, and does homeopathy has any treatment for this?
Yes. So it's true that health of a woman is mainly depending on her menstrual cycle. It's true.
Totally.
So here, many women you can see that usually 18 years female came with complaints of some breast enlargement or tenderness or heaviness or constipation or diarrhea 1 week preceding of menstruation. Like that, the complaints comes.
Okay.
So these are all we considered as that premenstrual syndrome. So premenstrual, we call PMS.
PMS syndrome.
Premenstrual syndrome. Okay.
Yeah.
So this is nothing but it's a set of psychological and social symptoms. So this is in every ovulating woman. So after ovulation till that menses occurs, this type of symptoms will be present. And in mild cases, every woman menstruate and almost all will having this type of symptoms, but there will be no disturbance in their daily activities.
Okay.
But in severe forms, so there is a severe disruption of their daily routine work, and there is a disturbance in their family relationship. There is a disturbance in their social relationship. So this PMS is very important. And so during this PMS, the woman may having that severe form of symptoms, I said, no, maybe irritability, maybe anger, and maybe that constipation problem, diarrhea, back pain, cramps, like you said, cramps, and the bloating of the abdomen, the flatulent symptoms. So before that, there will be no symptoms. But week before the menstruation, suddenly they may develop this type of symptoms. And there is some people, they will complain, before menses, I have become that total body has become water retention, the feeling of water retention. Like different presentation will be there. So homeopathy only will consider the each and every presentation or each and every problem of a person. So we'll take that everything. So every symptom will consider during that. So here that homeopathy having that very good number of remedies and excellent treatment for this. So I have treated this premenstrual syndrome patients also, like breast tenderness, So we have a number of remedies, even constipation. So we have graphites, conium, calicarb, like all these remedies, what I am telling for that only the understanding or educational purpose.
Okay.
It doesn't mean that these medicines will help for every premenstrual syndrome.
Okay.
So homeopathy is having that every woman is having individual remedy. So even though the two women are suffering with the premenstrual syndrome, they may having that two different remedies. So,
because their causes are different.
Yeah, the
Yes.
symptomatic manifestation, representation is different.
Okay.
So that's why we have to consider each and every symptom of a woman during that period. So this is that we call premenstrual syndrome. So every woman should have that awareness of this. For this, women should have that follow the proper diet.
Proper
For
diet.
that, yes. Should less take of that salt and sugar contents, and that proper exercise. Exercise is very important. That the stress aerobic exercises. Yes. So these are all helpful for her to prevent of this premenstrual syndrome. So this is one type of premenstrual syndrome. Apart from that, women may having that during menstruation, they will have that symptoms. So we call it is painful menstruation. So that is known as the dysmenorrhea.
So ma'am, you have given the detailed explanation about PMS, but many women suffer the severe pain during their menstrual cycle also. It's an ongoing process also. So what you have to talk about it?
Yes. So far we discussed about the
PMS, yes.
That is the 1 week before preceding the menses.
Okay.
So now that before telling that, I would like to tell a case which I have treated.
Okay.
A 19-year female came with the complaints of nausea, vomiting, back pain during menses.
Okay.
So the total 5 days of menses, she suffered with this. So this is not one month. So since 3 years she is suffering. Okay. So came with this type of complaints. So every month the 5 days is very, very crucial and very horrible days for her. And so in that situation, she'll not eat anything of the 5 days. Then she may develop hemoglobin low hemoglobin percentage.
Okay.
So other complaints also she will develop. And these 5 days she will not go to that school or college like that. And there is that interruption in her studies. So these are all very important factors in daily routine and their educational perspective.
Okay.
So here this thing. So during menses, there is that discomfort or any painful, we call painful menstruation. It is dysmenorrhea. We call it is dysmenorrhea. Okay. So during this period also, that few girls, they may suffer with a different presentation of symptoms. So few girls, they may suffer with that simple back pain. And this back pain may radiating to the thigh region, may radiating to the lower abdomen region.
Yes.
So there is a severe cramps in the legs and the nausea, vomiting, and there's loss of appetite. And apart from constipation, diarrhea, like number of symptoms are there during menses. So for this also, that homeopathy considered each and every symptom of a woman. And basing on that symptomatology, and here also the primary dysmenorrhea, secondary dysmenorrhea will divide that dysmenorrhea. So then here that some pathology, if it is any pathological symptoms. So in investigations, some pathological symptoms if we find, then basing on that cause, the treatment will be present. So usually that uterine fibroids, endometriosis,
Okay.
so that even PCOS. So in these situations, there is a severe pain during menses will be there. And otherwise, a simple functional dysmenorrhea will be present. So homeopathy treatment is basing on this cause. So the functional dysmenorrhea can be treated by that homeopathy, and even that abnormality or any pathological conditions also can be treated by homeopathy. Yes.
Okay, ma'am. So the last question, but which is also very important. Many women during menstrual cycle suffer from overflowing, so which leads to the loss of blood.
Yes.
So what you have to talk about it?
Yes. So apart from that, this is amenorrhea. We discussed that is no menses.
Yes.
So this is some other condition. So here that regular menstrual cycle will be there in the woman, but there is a profuse flow will be there, prolonged will be there.
Okay.
So it is that more than 5 days. So some female, they may having that profuse flow even that 6 days, 10 days, 15 days, like that. The overflow will be there. So there is a profuse prolonged flow will be there. So we call it is menorrhagia. So, and apart from this menorrhagia, profuse menses, this is acute condition.
Okay.
So we have to consider as it acute. So we have to stop the flow first. Then after that, we have to see what is that cause.
Okay.
Why she developed that type of profuse flow. So that also we have to consider. So here also homeopathy having that thorough case taking, and there that we have to see for that past history. And before that also she may suffering with the same complaint, or any family histories there. Her mother, grandmother, or the sisters are suffering with the same thing. We have to consider, and we have to think about any treatment history, any medicines she used for, and so these are all, and along with her all at home level stress and even work level stress, emotional level, and anything in the past her history, anything happened, any sorrow, grief, and some women may develop, there is a sudden loss of death in near and dear people. She may develop, there is a profuse flow. Okay. So these are some causes we have to elicit from the patient. So this is only possible by that thorough case taking. So here homeopathy having that very beautiful treatment for in every menstrual disorders. So for that we have to take a case. So case taking is very important. So in that we have to analyze that person, what is the cause and why that it is developed. This we have to analyze that, and we have to take the all total symptoms, so as the totality of symptoms, and we consider it is a constitutional remedy. With this constitutional remedy, so these constitutional remedies differ from person to person. Okay. So even though the two females suffering with the same amenorrhea, then the remedy will be different, because here we are treating the two individuals, not the two symptoms. That's why at the end, I would like to say that homeopathy treats the patient, not the disease. Okay. So we will take the case as a whole, and that we will consider and each and every case as a new case. Even though the same diagnosis, same disease, but each and every person as a new case. And as we said that we have that many menstrual abnormalities. So the only answer is homeopathy. So all menstrual abnormalities answer is homeopathy. So because of lack of awareness, many women they are undergoing that surgeries, that is a hysterectomies. Okay. So we treat without surgeries this all any complaints of that menses.
So ma'am, thank you so much for giving us the detailed information and educating us.
Okay, thank you Suman TV giving me this opportunity to share my knowledge and to share what homeopathy scope in menstrual abnormalities. Thank you very much.
Right. Viewers, so as doctor has already said us that homeopathy treats the person and not the disease. I believe that some of her information will be useful to us. Thank you so much for watching.